Hi, my name is Neela Kudos, and my topic today is aneurysm. In this presentation, I'm going to explain what causes aneurysms, who is most at risk, what happens in the body, the symptoms to look out for, and how doctors diagnose and treat them. An aneurysm forms when part of a blood vessel wall weakens and begins to bulge outward due to constant blood pressure. Arteries are under high pressure because they carry blood directly from the heart. If a section of the wall becomes weak, it cannot withstand that pressure and starts to stretch. Over time, the bulge can grow larger. There are genetic factors that increase risk. Some people inherit connective tissue disorders that make their blood vessel walls less elastic and more fragile. Having a close family member with an aneurysm also increases your chances. Environmental and behavioral factors are very important too. Smoking is one of the biggest risk factors because it damages the lining of the blood vessels and weakens their structure. High blood pressure adds constant force against artery walls, making them more likely to stretch and weaken. High cholesterol and plaque buildup also contribute by damaging the vessels over time. Demographics. Aneurysms can happen to anyone, but they are more common in adults over 40, and the risk increases with age. Brain aneurysms are slightly more common in women than men. In the US, about 1 in 50 people have an unruptured brain aneurysm, although most never cause symptoms. Around 30,000 people in the US experience a ruptured brain aneurysm each year. Risk is much higher in people who smoke, have uncontrolled high blood pressure, or have a family history of aneurysms. So while age plays a role, lifestyle choices also have a major impact. Anatomy. To understand aneurysms better, it helps to review artery structure. Arteries have 3 layers. The tunica intima is the inner lining that is in direct contact with blood. The tunica media is the middle layer made of smooth muscle and elastic fibers. The tunica externa is the outer supportive connective tissue layer. The tunica media is especially important because it gives the artery strength and elasticity. In most aneurysms, the middle layer becomes weakened. When it loses elasticity, it cannot properly handle blood pressure and the wall begins to bulge outward. This structural weakness is the foundation of the disease. Physiology and symptoms. Normally, arteries stretch and recoil with each heartbeat. This elastic recoil helps maintain steady blood flow and stable blood pressure. When the vessel wall weakens, it cannot recoil normally. Instead, it continues to stretch outward, forming a bulge. As the aneurysms grow, the wall becomes thinner and more fragile, increasing the risk of rupture. Many aneurysms do not cause symptoms at first, which make them dangerous. If a brain aneurysm is unruptured but large, it may press on nearby nerves, causing headaches, vision problems, or eye pain. If it ruptures, it causes sudden bleeding in the brain. This leads to a severe headache, often described as the worst headache of someone's life. It can also cause nausea, neck stiffness, confusion, or loss of consciousness. A rupture can lead to stroke, permanent brain damage, or even death, which is why early detection is critical. Diagnosis, treatment, and AI. Aneurysms are usually diagnosed using imaging tests like CT scans and MRIs. These allow doctors to see the size, shape, and exact location of the aneurysm. If the aneurysm is small and not causing symptoms, doctors may recommend monitoring it regularly while aggressively controlling blood pressure and encouraging lifestyle changes like quitting smoking. If treatment is necessary, there are 2 main options. Surgical clipping involves placing a small metal clip at the base of the aneurysm to stop blood flow into it. Endovascular coiling is a less invasive procedure where coils are inserted through the catheter to block off the aneurysm from the inside. Both procedures have risks such as bleeding or stroke, and patients usually need lifelong follow-up because new aneurysms can develop. Artificial intelligence is now helping doctors detect aneurysms earlier by analyzing imaging scans. AI models can also help predict rupture risk based on size and blood flow patterns, involving treatment, planning, and patient outcomes. In conclusion, an aneurysm is a weakened and bulging of an artery that becomes life-threatening if it ruptures. It develops due to a combination of genetic factors, blood pressures, smoking, and long-term vessel damage. Many aneurysms are silent, but when rupture occurs, the consequence can be severe. Thank you.